I'm Dr. Sushil Meher. More than 32 years I'm working in AIIMS New Delhi. And my primary responsibility is that the digital journey, that is your digital transformations, bringing the new technology in the healthcare, cyber security, data governance, and adaptation of the technology within the organizations, and promote the different technology to other hospitals. And simultaneously, we do the high level of teaching and the healthcare research. Second part is my journey. I have joined in 1992. At the time, very hardly people know that what is the computers and what computer can do. When I discuss with many people, they say, what is the use of computer in healthcare? Hardly any hospitals they have their computers at place. At that time, 1992, we have the high range of mainframes. It has been installed, and we have started computerization of AIIMS. The objective of the computerization it was that make the system easy, because the demands to come to the hospital by the different state of the patients is very high, and if you make the things easy, then you have to use the technology. Second part is that the large amount of data is required in healthcare research. As AIIMS is high level of research institutions in healthcare, they need the data. Without data, it is not possible to do any research. The technology, it was not that extent that you can give that level of computerization what today is going on. Another one is that at that time very limited people they are using the Oracle, and Oracle is a new database at that time, and we are the second user of Oracle in the country. You have to train ourselves. Simultaneously, you have to replicate everything to other users within the organizations. This is a big challenge. For this, we have started motivating to the users. We have taken the ownership of that. In a government organization, it is a problem that nobody is ready to take the ownership. Okay, and when you will not take the ownership, you can't implement anything, or you can't use the technology in the organization. Second part is that there is two things you have to understand. One is the medical profession. Medical doctors are highly regarded within the society as well as in the professional society also. And another part is the new IT professional within the healthcare organizations. There is some little bit of conflict is that when you ask them to use the computers, you can't force them to use it, because it is a healthcare organizations, and healthcare organization culture is different. I can't change the culture. That is the major challenge of that, because when the doctors not cooperate me, the healthcare worker is not cooperate me, I can't implement. And that culture to bringing it is not so easy, because it is not very user friendly, and I can't put a new user for each and every sessions to do real-time updations. It is very challenging, because healthcare services 24/7 services required. There is a lot of demand and supply gap is there. Okay, right now what you are taking 10,000, it is about to be 15 to 16,000 patients a day, and the demand is more than 3 to 4 times. So when the demand and the services is a lot of gap is there, then lot of problems it comes. Lot of problems in the comes means people will try to come to the hospital in a backdoor method. Some backdoor approach they might be put it, and lot of curiosity is there also, because they want to get. So we have done a thorough scientific study that how to make this is very transparent and smooth manner, because when demand is very high, definitely some people will do some mischievous work, and only the transparency will give if you do the full computerization. Earlier what it happens, earlier in manual systems we have number of cards. It will come in the morning, it will distribute it within the patients. These cards some people mischievously they have taken, and they are selling in the market. It has been observed. So the best way to stop this one, we have started using the technology, and for this we have started online registration system. But when we found it, we have seen that people are making a queue more than 20 hours before to get a slot for the doctors to show it, and it is very painful. Somebody is very sick, and someone is standing in the outside in different weather. It may be a hot summer, it may be a very cold winter. We found that why not we'll do something which is more convenient people to use it. And we are the first public hospital or institute, you can say it is an institute, come with the online appointment systems. This is the first in the country, and we have done the online appointment system through call center, through apps, through website, or you come to the counters and take the appointments wherever you need it. But that is not the final solution for us, because demand and supply, again the gap is there, the transparency has come up, but some people, what they have done it, they have taken the appointment in one name. Let's take the patient name is XYZ, but when the patient is coming, ABC patient is coming for this, because patient ID is not been verified. Means again it is the problems that when we have seen that the patient is somebody else, and the appointment has done somebody else. So in that cases, what we have done it, we have thought a lot, and we have come with the registration with their Aadhaar based, or right now government has come up with Aadhaar ID based, we have started it. But the problems what again still it exists, that if we'll do whole, let's take 15,000 or 16,000 OPD, all appointment based, we have found more than 60% dropout. They did not come. So what we have done it, we have done a clear-cut study, how much slot to be through appointment system, how many slot they can make a physical queue in the same day and show it, and how many slots you have to make it that the patient is coming for revisit. So in this things, after taking the data analysis and all this, we have done it, we found that 40% it's supposed to be online appointments, again 30% physically come and make a queue and show it, and another 30% we have done through the revisit patients. So that way we have managed the crowd, because when the patient is making a crowd, you see 16,000 people in a day, and they will make a queue, means around 50,000 people are on the queue to getting the slot, because each patient has one or two people. So this is a very painful journey. This is transformed today, and we have done it. Second part is we have thought it, when you have an appointment, is it required to go to the counter to do the registration? Again another queue is there, and queue is the biggest challenge everybody, that you'll stay for a long time, you'll not feel good, and first impression is the last impression of the hospital. If you make a queue is less time in the queue. So in this process, what we have done it, we have developed the application integrated with Aadhaar, Ayushman Bharat Digital Missions, and you have distributed in different locations the QR code, and we have given the Wi-Fi to all the patients. They have to scan it. After scanning, it will ask you have an appointment or you want to do without appointments. Okay, if you have appointment, if you give the appointment number, details, it will come to your screen. Then they will ask you, because the appointment numbers, then it will come with your details of your demographic details. Next it will come that it will ask you that which slot is required, you can choose it. After that it will ask you the Aadhaar ID. If you do not have the Aadhaar ID, then it will ask to create a Aadhaar ID. When you create it, it will generate the new Aadhaar ID, it will fetch it, and it will give a slot to you, and from your mobiles you will go to the doctor's room directly, and there also we have done it. We have made a slot. Okay, these are slots. If the slot is 10 to 11, so you be there at 10 to 11. If your slot is 12 to 1, and you are at the time your watch is around 9:30, so it is not required to the hall. You go to the cafeteria, you go to the somewhere else, okay, and find your own time. So these are the things you have aged the issues of the patient, and the patient experience has gone up. Second part is that doctor experience, what you are saying. When the large scale of patient is coming, on average, each doctor is seeing around 50 to 60% a day. It might be also more than that people are seeing it. Even hundreds of people are crossing it. Some doctors, they come at 8 o'clock and they go at 8 or 9 o'clock in the evening. What kind of means you have to empower to the doctors so that they can treat the patient very fast, more accurate manner, and you can ease the queue of the patients also. So first of all, what we have done it, each OPD has gone to the computerization mode. When we'll scan the QR code of the patients, if the patient has done the test all this thing, it will fetch in the system and immediately they can see it. If some OPDs do not have that system, so they can take the printout on the counter. They'll provide you the printout of the reports and go to the doctors immediately. So that problems it is from the patient as well as from the doctors. We have done the totally digital radiology systems. Okay, so you do not require to carry the radiological image, okay, films with you. If it is done in AIIMS, so you go directly, it will display in your systems. But in few places it is done, but it is going to be done each and every place in the hospital. So these are the means small things, it has been taken care of it. Third thing is that doctors always they feel that if the patient record is saved, so their research work will be much more easier. Okay, because without data they can't do it, and the data which is been stored in is more accurate manner, as well as the quality of data is there. And third part is that it can be accessible at anywhere, anytime to do the research work on particular disease. AIIMS is an institution for national importance. Many other organizations, they are interested to collaborate to do the work. And second part is that AIIMS, the objective of the AIIMS is that they want the high level education which can be transferred to the other institutions to adopt it and research as well as. So that's why the AIIMS is always looking towards that collaborative mode. Okay, you might have seen recently that government has given 300 crores for AI to develop the models, and it can be used by across the country, whether it is a private or government. Okay, all the people they can use it. So that's why this is the one initiative which has been AIIMS has started it. Recently we have developed one application, that is ioncology.ai. This is one platform that has been created, and this has been used by many users already. Means around 15 or 16 medical college, some are the privates, they have started using it. So this is the one kind of collaborative models which is you are working since long time to do it, but the cultural changes has to be required from the both sides. Private sectors, their business model is different than the AIIMS business model. And second part is that data governance. When you will collaborating somebody, patient data is very precious, and right now the regulatory is coming up, the DPDP, as well as some new regulatory will come for the healthcare also. So patient data, the sensitive data, how it can be governed, that is the things we have to looking towards it, which is not been in place till date by the government of India. Some of the things it is coming up in EHS standard of the government of India, which has been given data governance, but it is not being implemented fully by the different organizations. The major challenge is that healthcare is a state subject. Okay, it is not a national subject. Each state has different means rules, regulations are there. So in that case, to cope up with this, it is a big challenge. But first part is in collaboration, the major hurdles is the data governance. That's why it is not picking up in the future. But when the data governance, it will be in place. The DPDP Act has to be in place. In that way, some light it will come, not in fully, because healthcare governance is totally different than other domains. AIIMS is always look towards that, the good quality of healthcare. That's why AIIMS always be a position number one in the country. Okay, but to reaching this level, AIIMS never lacks in the technology. If we talk about 1960, at that time also we have started using computers, and today we have the supercomputer at our place. So these are the journey AIIMS had. Means it has a lot of potentials as well as the exposure to the technology, and they do not want to lag behind in the technology. Let's one example I am giving to you. We are the first in the country. We have used the patient, we have empowered the patient to do the registration, whole registration process from the OPD hall, from their mobile. It is integrated with Ayushman Bharat, AIIMS registration process, and doctor registration. Everything in the single app they can do from their mobile. This is the one thing we have done it. Second part is that what we have done it, the demand and supply, already I have told you. See how much demands AIIMS has. We have some scientific study we have done it. Then we have figured out that how much patients to be done through the appointments or by physical or revisits. So this sort of very scientific way we have studied, and then we have decided that what is the percentage of that. Third thing is that we have bringing the technology to make the labs computerized and the new technologies to be adopted. So we are the first in the Asia that we have robotic labs and which is in place 2020, and these labs just as two things are there they do it. One thing is the doctor has to decide what test has to be performed, another one is the sample has to be collected manually. Rest of the process, everything it is already through the system. The robotics, they handle everything. Reporting also automatic. The reporting automatic means the AI will report, AI will read the reports, they'll see that this reporting is correct or not. It will be indicate to the doctors that you can pass this without going through it. This is the reports, it may some error is there, please check it. So in this way we are saving the doctor's time and simultaneously we are giving a quality and accuracy of reportings. Third thing is that already I have told you that AIIMS is a center for excellence in AI and lot of AI projects are there. One example I am giving you. It is about 5 to 6 years back. We have developed a own model in AIIMS that early prediction of the infection to newborn disease. Okay, when baby has born, it has gone to the neonatal ward, and from there our system will ready to predict that what kind of infection this baby may come. So before the hand, the doctors are ready for the treatment on this line of. So this is one of the things. This is a real example of that. Another one is that people have started using AI, that is cancer, early prediction of breast cancer and ovarian cancer, and this is the highest number of death in the country nowadays in India. So we have developed iOncology.ai and we have given to the others to use free of cost. It is not we are charging to anybody. So these kind of things we are doing it, and we are doing for the humankind and for the national importance, not for the individual.